So yes, we've had a few situations where the patients were struggling in the home due to their conditions and the deterioration in their symptoms. And we have two situations where upon initiation, we quickly realized that through an assessment of them, that the caregivers were struggling, the loved ones were struggling with this deterioration in their spouse's condition and really unsure of where to turn. So this is quite common. I saw this often in home care as well, is that patients are discharged into the community after an episode or a hospitalization, and they don't know which resources to access and how, and so then they struggle trying to manage their loved one at home because they want to keep them at home. And so with these two situations, we were able to intervene again with the pharmacy, collaborate with the family physician to make sure that these patients had received a home care assessment quickly, because the caregivers were quickly declining themselves and their own health was becoming at risk and feeling overwhelmed. And so we were able to collaborate with the family physician, suggest that a home care referral be initiated. In one situation, the GP recommended a geriatric psychiatric referral because that seemed to make much more sense at the time. And so we were able to expedite that in a sense and advocate for them on their behalf. Many of these caregivers are so overwhelmed they don't know even who to phone and how to articulate what their needs are and how overwhelmed they are. And so with their consent, in both those situations, I was able to advocate and phone the family physician on their behalf, and they were reassessed quite quickly by the doctor. We had a home care team initiated into that one home. We had social work, physiotherapy came in, and an adult day program was offered for respite. And I really believe that had they not been attached to the time, they may have struggled a little bit longer. They would eventually have found these resources, I'm sure, but I think with being attached to the system, they were able to receive it sooner and be a little bit more aware of what's available to them through us. We were able to advocate for them when they were feeling completely overwhelmed with all of the changes.